What is the SLiM-CRAB criteria, and what symptoms should patients be looking out for? For many years, we defined myeloma by what was called the CRAB criteria, C-R-A-B, which means these were the signs and symptoms that people developed with multiple myeloma. Let's walk through them quickly. C, or calcium, stands for a high level of calcium in the blood, typically because the bones are affected myeloma and calcium leaches out into the blood. R stands for renal, or kidney damage, because the protein that's made by the myeloma cell attacks the kidney. The A, or anemia, refers to a low red blood cell count, which makes people tired or fatigued because they don't have enough hemoglobin circulating in their blood. And then lastly, the B, or the bones. Unfortunately, myeloma attacks bones, so sometimes it can just be a thinning of the bone, or sometimes it can actually be bone fractures. Well, a little over 10 years ago, we added more criteria to this called the SLiM-CRAB. I, in fact, had the privilege of giving us the name SLiM because we added 3 more features to that. S, or 60% plasma cells in the bone marrow. Light chains, which is the part of the proteins that myeloma make, if the involved over the uninvolved light chains are over 100. And lastly, if we do an MRI of the bone marrow and we see more than one focal lesion. These form the 7 myeloma criteria of SLiM-CRAB. It's important to know them because these are the features that help us make the diagnosis of myeloma and that focus our treatment so that patients can feel better. Too many people say, "What's myeloma?" Let's change that together. You can raise awareness during Blood Cancer Awareness Month by sharing this video with your friends and family. You can also post using the hashtag #KnowMyeloma, K-N-O-W, myeloma. The more people know about myeloma, the louder our call for earlier diagnosis, greater access to treatment, more investment in research, and equity in cancer care. Let's make myeloma known.